Hello everyone, I am going to explain esophagus E-junction tube function and three ways of food travel in this E-junction tube. E-junction tube is placed between esophagus and stomach. E-junction tube looks like a T-shape. One end is connected to the esophagus, the second end is connected to the stomach, and third end which is protruding out from our body. The first way of food travel, which is similar to normal esophagus function, which means the swallowed food from the mouth passes through the esophagus and reaches the stomach. In this condition, the E-junction tube feeding cap is in closed state. It prevents the outside particle entering into the stomach, and the blocker is in open condition, which allows the food freely passes from the esophagus to the stomach. The third way of food travel in the E-junction tube is passing the food directly to the stomach, which is similar to G-tube. The currently esophagus cancer patients is fitted with G-tube. The major difference between the G-tube and the E-junction tube is bigger feeding tube diameter, which helps the easier feeding, and you can also feed the higher grain size food to the stomach. In this condition, the feeding cap is in open state for the tube feeding and the blocker is in open condition for easy passage. The stomach gas comes out from this E-junction tube to the atmosphere. Currently the gases comes goes through the esophagus and escaping to the atmosphere through mouth. It produces the sound burp that can be avoided. The third way of food travel in E-junction tube is extracting the swallowed food from the esophagus to the atmosphere before it reaches to the stomach, uh, which helps for the weight loss. And it will be an alternate solution for gastric sleeve and gastric bypass surgery. Uh, the blocker separates the esophagus and stomach, and the solid food can drain out from our body through the feeding cap. This E-junction tube also helps for respiration, for inhaling air and exhaling air. Uh, and it's an additional air passage for our lungs. The, the currently the lungs air passage for the lungs is nose and mouth. With the help of nose and mouth, we are inhaling and exhaling the air. Um, and I would like to highlight some current respiratory system concerns. The first one is the food can pass to the lungs, that, and second one is snoring and sleep apnea due because of the narrow passage in our respiratory system, and it requires some muscles contraction. And for that one, in the proposed E-junction tube, the air can enter through this E-junction tube and it can passes through the esophagus and reaches the lungs. During this state, the blocker is in closed condition. During sleeping, we can keep it in the blocker closed condition, and it prevents the esophagus and stomach, so the air from the atmosphere can passes through our lungs due to the higher width of the esophagus tubes and other the less muscles contraction and easy breathing can happen, and snoring and sleep apnea can be avoided. Mm, and I would like to know your comments from viewer, doctors and surgeon, because I'm going to manufacture this E-junction tube using my patent rights. You can reach me at my mobile and email address for your feedback and comments. Thanks for watching. Have a good day.